What's your experience been in terms of are physicians using the PDMP in the same way that you're using it as a pharmacist? We know that all 50 states now have access to some flavor of a prescription drug monitoring program.
Mhm.
So theoretically, everybody should have access to use these tools in the same way and get the same use cases out of them. Are you seeing that providers and physicians in different health settings are using it to this capacity, or is it being used as a checks and balances system when prescribing narcotics only?
I think that's such a good question because I think it really ties to, different almost like kind of like the shortcomings in terms of our current practice, right? And I would say I see like a mix 50-50, and Shelly, definitely share your point of view after, what I'm sharing, because we do want to hear, in two different settings, what are we really seeing? But for me, if, say, for example, for like physicians who have been practicing for some time, they have more experience in terms of interpreting or even having that as a habit, right? Because having reviewing PDMP as a habit versus even not reviewing it as part of the habit, that makes a huge difference. I would say that with physicians like who are new grads or residents, and those are like the group that has like a bit of a learning curve, because some of the thing that we almost like we're not acknowledging as well as we should is that, and I can speak for myself, is that back in pharmacy school, or even when I was doing rotations, so basically kind of the on-site apprenticeship. And so even in those times when it comes to reviewing PDMP, like the knowledge or the teaching that I receive isn't necessarily the most robust. And I'm not saying that it's anything bad, but if you ask around, right? If we ask around different physicians from different area, let it be pharmacists or PA or physicians, then it seems to be like there is a lack of education when it comes to pain management, and specifically pain medication management, right? Because we hear pain medication or pain management a lot, right? We know the general concept: use the least effective, minimum effective dose, and be mindful of the interaction. Know that it's a very risky medication, and pretty much that's that. But the in-depth education of PDMP sometimes is lacking. And even for my training, when I'm training like residents or new practitioners, I tend to see that that is something that's lacking. The in-depth interpretation, the knowledge of how to utilize it, like you said, is lacking. So that's what I see. And I was wondering if Shelley has a different viewpoint or it's something similar.
Absolutely something similar to Sing Ping. The issues that we face are similar, but specific to our work settings. I agree that new providers, into new graduates, have no idea, and so catching them to explain, hey, this should not be just a knee jerk thing because we have to if we're giving them a prescription. It should be part of your workup, like an assessment of any patient, not just a pain, because it does controlled substances, benzodiazepines, stimulants. Some seizure medications are controlled medications. So for my state, we only have the prescription controlled substances that get reported. If I had everybody's drug report, like maybe some state does, I think that would probably be information overload for me. But just coming from how I operate, but standardization across providers, even within a health setting that has been doing this for as long as since I've graduated residency, so over 10 years, it's all over the place. And so that's a struggle. And it's just, you can't avoid helping. You have to educate so that they can stay up with the times and know that it's a tool in their toolbox.